The World Health Organization is warning consumers about the rise in fake weight loss drugs. Joining us now is Dr. Suki Singh from Henry Ford Health. Thank you for being here.
Thank you for having me, Terrence.
We are glad to have you. As more people continue using these weight loss drugs, there is a lot of demand for them. So really no surprise that these counterfeits are popping up. But what do people need to know to make sure that they're getting the right thing?
You know, it's really scary. Some of these medications that are coming out don't have a serial number on them, or there may not be any lot number. Boxes have spelling errors, batch number errors, needles that are being sent out to patients are not stable or sterile. And it's a very scary thing to see as a provider that my patients may be getting this from a fake pharmacy or a sort of a non-credentialed doctor or a provider.
Yeah, and it's like they're taking advantage of the demand and the fact that so many people are desperate to get a hold of this medication. What are some of the dangers of taking the wrong thing? Because there's extensive studies on this medication to make sure that it is safe.
Correct. First of all, you know, it's a medication you're injecting into yourself. So you want to make sure the needle you're receiving is a sterile needle. Second, the dose is very important. You have to get educated on the right type of diet to follow on these medications because the side effects are scary. Low blood sugar, seizures, kidney disease because of dehydration from nausea, vomiting, diarrhea from an inappropriate dose. So again, you really need to be monitored with the right clinician and with the right type of diet when you're on these medications.
So what is the proper way to get these medications? Because sometimes you'll see these ads popping up and they look to be
Mhm.
legitimate, but is that the right way to go?
Yeah. Patients are desperate because finally there are some answers to obesity treatment. So we always recommend, first of all, talk to your primary care doctor that you have a relationship with to ask about treatment options. Based on where you are with your disease process, with the disease of obesity, they can guide you to the right physician or the right clinic. From there, they can help develop a comprehensive plan for you with the right type of diet and exercise plan with the right medication, right dosing. So it really needs to be a comprehensive plan of action for the patient instead of just writing a prescription.
You mentioned some of the side effects there. Do we know yet if there are any different side effects with the fake versions? Also, does it even work, or what are those people injecting themselves with?
Some of it is unfortunately an inactive form of the medication. So patients are paying per injection at med spas where they may be told a different dose, but they're actually getting a different dose. So their weight loss isn't the same. On top of that, they may also be at a higher risk of infection because, again, the sterile process is not being followed for the injection itself and the needle dispensation. And then you have to worry about the GI side effects of nausea, vomiting, dehydration. And again, because of how and where the medication acts, you really need to follow the right diet when it comes to managing those side effects and minimize complications that can arise from the wrong dose on these medications.
It looks like based on some of these online providers, some of them are also offering this medication in pill form. But that's not something that we've really heard from those major providers like Ozempic or Mounjaro. Is that something that we know of, or is that another thing to spot out that could be a false version of the medication?
The pill form could be semaglutide, which is also known as Rybelsus from Novo Nordisk. And I have not seen or heard of any cases that are a fake form of the medication. But again, this might be something so early that we don't know enough about it yet.
All right. Lastly, just any final message for people who are maybe considering trying this medication or not really sure how to go about getting it or whether or not they should or can talk to their doctor.
You know, at Henry Ford, we really try to make sure every patient that walks in through the door, they get a full comprehensive blood test done and a full history and physical completed so we can determine the right type of medication for that patient. Because of the side effects that can be associated with these medications, it's not something that you want to take lightly. So start with talking to your primary care doctor. If you've had weight loss surgery, talk to your surgeon. They can help direct you to the right clinic and the right space to get you back on your weight loss journey.
All right. Very important message. Again, we thank you for your time.
Thank you.